This patient was referred to me for multiple teeth. This is tooth number 10, porcelain crown on the tooth, and look at that large periapical lucency right there. Patient also had symptoms. Tooth was tender to percussion palpation. Probings were 2 to 3 millimeters. And again, you can see a large periapical lucency right there. So today we went through the porcelain crown and take a look. One necrotic canal, and as you can see, everything went beautifully. We went ahead and temporized the tooth and moved on to the next tooth. And let me show you the next tooth now. All right, look at the next tooth, tooth number 12. This root canal was done by the patient's general dentist a few years ago. Take a look here. You can see the missed root here. I don't need to take a CBCT. I can read x-rays. Take a look. So that's the palatal canal. Look at the buccal root, completely separate from the palatal root that this dentist had missed. See that? That's palatal root, and that's the buccal root right there. And as you can see, periapical lucency there. This was this. All right. So a plastic thermofill carrier. And that's why I don't like these plastic thermofill carriers. I like him. It's just a material. How can you not like a material? Material is not the problem. The problem is the dentists who use these type of material, usually, not all of them, but most of them, do root canals like this. All right, so went through the porcelain crown, removed that plastic thermofill carrier, as I showed you right here. Located that missed buccal root, buccal canal, completely separate from the palatal canal, and take a look. Now we're talking. So as you can see, everything went beautifully here. Look at all of this anatomy in the apical few millimeters of the canals. Look at all of this. Look at all of this anatomy here. There's so much anatomy here. All these laterals and anastomoses and look at that beautiful lateral right here also. Yeah, everything went great, as you can see. Yep. Bye, see you tomorrow. Everything went great, as you can see. And we moved on to the next teeth. We wanted to do four root canals because we sedated her. So we wanted to do as many. She needs a lot more. So take a look here. Lower left side. Yeah, she needs bunch of more root canals and stuff, but let's see, lower anterior. Okay. All right, so look at teeth number 27, and 28 now. 28 had a temporary crown on it. So as you can see, 28 large decay here, 27 decay right there into the pulp, 28 large decay into the pulp. So I removed the temporary crown, cleaned out the decay, and unfortunately there wasn't much tooth left coronally. So I went ahead and did pulpotomy just to make sure that she doesn't have any pain afterwards. But unfortunately, she would have to have tooth number 28 extracted Tooth number 27, take a look here at tooth number 27 now. So tooth number 27, my working length was 27 millimeters. And I'm like, okay, let's see, because she's a small lady. So I'm like, all right, let's go ahead and take a working length just to make sure. And you can see that I was right on. So my apex locator was correct, 27 millimeters. And I just also wanted to make sure that this tooth didn't have two canals. So we went ahead and took multiple angulation PAs with the file in the tooth working length, just to make sure. And as you can see, it's centered. It's centered. So doesn't matter what the angulation is, the file is centered, and that tells me that there is only one canal. And of course, I work under a surgical operating microscope. I did trough lingually just to make sure and didn't see anything. So one canal, and take a look. So perfect, as you can see, and look at that beautiful lateral there. I'll show you another angulation. You can see tooth number 28. Really not much left of the tooth once I cleaned out all the decay. Decay was pretty subgingival as well. All right, so take a look here. Look at that beautiful lateral right there. Right there. Look at that right there. All right, so that's tooth number 27. As I said, tooth number 28 needs to be extracted. All right, and that's it.